Okay, this is the second patient of today, and it's female. Quanti anni hai? 42 years old, and we can see a loss of tone of the zygomatic arc with the malar area goes down. Si può vedere appunto questa deplezione dell'arcata zigomatica con la zona malare della guancia che tende a andare verso il basso. So in this case I will perform a volumetric improvement of the zygomatic arc with by a cannula. E qui andrò a fare appunto un rimpolpamento di quella che è la regione zigomatica con l'innesto di filler volumetrico con una cannula. Before I show the treatment by a needle, now by a cannula. So I have only one access point, and my access point is here, in the middle of the malar area. Sarà un unico punto d'accesso al centro della guancia che mi permette di andare ovviamente su tutta l'arcata zigomatica. Ok? Let's start. Ok, vieni Margherita.
Did you have a before and after peak for the Rhinofiller injection? Now, no, but this video is recorded and I send you the video.
Okay. Allora,
with photos
e poi vado
after and before. Before and
che
after.
È il buchino ovviamente dell'acqua, e poi entro con la cannula. Qualsiasi cosa tu me lo dici, io mi fermo. Va bene? For this patient is the first time of filler injection. So I was explaining to the patient the treatment. For the volumetric filler, I use the 25 gauge cannula. We can use also 22 gauge cannula. Quindi dicevo che per il filler volumetrico io solitamente utilizzo una cannula da 25, ma si può tranquillamente utilizzare una cannula da 22.
22?
22. 22 gauge. But now I use 25.
Okay.
I usually use 25 gauge cannula, but we can also use 25. 22, sorry. Passo un'altra garzina.
Partecipanti.
Disinfection of the skin is very important to avoid complications like infection. So it's very first passage. Ovviamente la disinfezione cutanea è fondamentale per evitare ovviamente infezioni cutanee. Io solitamente faccio 2 o 3 passaggi sempre. Usually I disinfection for 2 o 3 times the skin area to treatment by filler. Scusami, ti grattugio un pochino. Ok.
Check and jawline come with the cannula inside the package or only with needle?
No, in the package.
In the pack there is only the needle, no
Yeah,
cannula.
No cannula. Okay. To use the cannula, I have to perform an access with the needle. And the needle and the cannula was in the same package, okay? I can show. There are a lot of cannula on the commerce, and usually in the package there is needle to access point and the cannula, okay?
Okay.
Okay, so first access point with the needle. Allora, senti un pochino. Okay, access point by a needle, okay? We can see the needle into the skin.
Does for you the age of the patients makes you choose the method cannula or needle?
No, 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 no. The age is not important to decide the use of the cannula or the use of the needle. It's the same. It's depend by psychological patients and not by age of the patient. So if the patient want only one access, the best is a cannula. If for the patient is the same, we can use the needle or the cannula like we want, so no different, ok?
La domanda in italiano era quella che si usa la canula o il lago in base all'età? No, dipende da altri fattori, ovviamente, dipende dal tipo di trattamento e quello che vogliamo ottenere.
Esatto, cioè l'uso della canula o del lago non è assolutamente età dipendente, ma è semplicemente, diciamo, quello che il medico vuole utilizzare. Solitamente io decido canula o non canula sulla base di quello che il paziente mi chiede. A volte il paziente mi chiede un unico buco, minore invasivo possibile, allora si utilizza la canula. Ovviamente con l'ago, come avete visto prima, ho fatto 3 accessi per l'arcata zigomatica. In questo caso farò un unico accesso al centro della guancia. Quindi ho fatto il buco e nel buchino entro con la canula. Allora, sentirei un attimo premere, scusami.
In English?
Ok, I started the treatment, I entry.
In your opinion and experience, the best result is by needle or?
Are the same, really, the same. Allora, inizio ad iniettare. Start to inject. By a cannula, through the cannula, the injection, it's harder than a needle because the cannula is 5 centimeter and the needle is 13 millimeter. 13?
Yes.
Simone? Okay. So, by a cannula...
No, 25 millimeters, sorry. The percentage of hyaluronic acid, Marco?
No. La lunghezza della...
Oh, yeah, yes.
So the cannula is 5 centimeter.
Yes.
And the needle is 1.3 centimeter. So through the needle, I think that it's easier than a cannula, but the results are the same. Dolore? Pain? Little bit.
Pico. Sì, pico.
Poco. A little bit of the pain, okay? So, in the first point, I perform the treatment. Now, I go. We can see the cannula under the skin, okay? The plane is a deeper plane, and not superficial plane. Is a plane on the fat of the face, okay? And when I go through the fat of the plane, we can see the septa, because the fat compartment of the face is divided in areas by the septa, and when I go through by the cannula, I can feel when I go through the septa, okay? Sorry, a little bit of pain. Okay, first vial. Now I go to inject the second vial on the same side and show you the difference from the first side and the second side that I don't inject, ok? Allora, puoi tenere un secondo così, vado a fare ancora altro prodotto sulla parte laterale, ok? Now I go on the lateral zygomatic arc in the same side of face. Allora, adesso vado a fare un secondo passaggio su quella che è l'arcata zigomatica laterale. Ok, lascia pure. Ok. Through the same access point, where is? Ok, is here. So, dallo stesso punto di accesso. Scusami. I have the tissue very hard, so if I don't entry, I can use again the needle, but now okay. Okay, this is a plane, my zygomatic arc, and now start with the injection. Puoi sentire la dilatazione. The patient can feel the injection on the tissue, the dilatation of the underskin tissue. It's a fun technique on the zygomatic arc, okay? And this is the last. Okay. No bleeding, ok? Non c'è ovviamente sangue dal punto di accesso. Qualche volta si può verificare una piccola fuoriuscita di sangue, basta una lieve pressione. A volte si può prendere il capillarino con il punto di accesso del lago. Sometimes can happen a small bleeding from the access point, no problem, only small capillary, small vein of the skin, and by a little pressure we can stop the small bleeding. Now I want to show you the difference between the side. Right side with the treatment and left side without the treatment. Ok. Ti puoi alzare? Short massage. Okay. We can see the difference or not? I think yeah. Okay. Zygomatic arc and without treatment. Okay? Any question? If there aren't any question, go to the second side, the left side. Okay? Bene. Dolore?
No.
No, me lo devi dire. Dolore?
No,
È più una sensazione, è
Sì,
la prima
una
volta.
sensazione.
Ok. The patient hasn't pain but feels strange because it's the first time. Okay. So I change the cannula. Usually I change cannula from side. Okay. First side one cannula. Second side I change the cannula to avoid a complication like infection. The treatment is the same.
Cannula provides really good results.
Yeah. Disinfection, 2-3 passage, okay? Also because the patient have a makeup on the skin. Usually, all my patients come in my in my work with makeup. And they told me, but doctor, we are female, we are woman, so it's very difficult to speak about makeup. Okay. Second disinfection. Okay. So in this side, I don't make a picture, but if you want, I can do to show the zygomatic arc. Scusami, torno un attimo sopra, faccio velocemente il disegno. Okay, my access point is in this point, in the middle of malar area, and my area of the treatment is this area. Okay? Yeah, and you. So, first, access point. By a needle, I remove the mark. Allora, senti un pochino. I perform a little bit pressure on the access point to avoid short bleeding. 30 seconds. Ok. Scusa. The tissues are very hard. Scusami. I tessuti della signora sono
Fibrotici.
molto duri. Ok. Very well. I am on the right plane. Under skin plane, not superficial plane. I'm using a volumetric filler, so deep plane, not superficial plane. puoi sentire la dilatazione. You can feel the dilatation of the plane. Okay, I change my angle. From medial side to lateral side. Change again. Sometimes the patient can feel a little bit pain, but it's normal. Okay, so first vial is done. Now I perform the second vials in the lateral zygomatic arc area. Puoi tenere un attimo? Grazie. Lascia pure. Ok. Così. Perfetto. Now I change my side of the patient because I am more comfortable in this side to go in the lateral arc, okay? Second vial. Ok, with the canal. Scusami, se hai dolore me lo devi dire. Okay, in this case I want to repeat my access point by a needle because the tissues are very hard.
You can feel exactly on bone by moving the cannula on bone while you are feel it.
No, in this case, with the cannula, I can't feel a bone because the injection, it's not perpendicular, but like when I use the needle. So I stay on the deep plane, but I can't feel the bone like by a needle, okay? Okay, with my needle, now the access point, it's perfect. Okay, lipoplane, and start the injection of second vials. Dolore? Ok, no pain. Il paziente non ha dolore. Per chi segue in italiano mi hanno chiesto ovviamente se con la canula sento l'osso. Ovviamente la canula ho un tragitto diverso dal lago, nel senso che col lago vado a fare un'iniezione perpendicolare, quindi è molto semplice sentire l'osso, cioè vado col lago fino al tessuto osseo per poi andare ad iniettare. Con la canula io seguo un tragitto, diciamo, più tangenziale all'osso. Devo stare su piani profondi, però sentire l'osso con la canula è quasi impossibile. Okay, so this is my access point, only access point for the zygomatic arc volumetric improvement. Okay, now I remove the Mark. Scusami, perdonami, ti tolgo. Ti faccio anche un massaggino. Now I massage the area for 30 seconds. And I show you the patient after 2 vials for side, okay? Do 2 vials on the left side and 2 vials on the right side. Ok, ti puoi tirare su. Okay, we can see the lift effect of the malar area after the treatment. Okay, no bleeding, no hematoma. The access point is invisible on the left side, and it's invisible on the right side. Okay, and on the live we can see a very important difference between before and after treatment. Okay, I don't know if by camera we can see the difference, but believe me, the difference is very important. Okay.
Okay, I'm finished
Perfect.
with these patients, and 3 minutes of break, and after the third patients for Rhinofiller.
Rhinofiller by cannula, okay?
One moment, one question. Avoid putting pressure to treated areas, for example, when sleeping, to not affect the filler?
No. With the volumetric filler, with Opera 4, with Opera 4, there aren't complications for pressure, for sleeping, so no problem of this in this way, okay? So, okay, 3 minutes of break, and after the third patients, okay? See you.